Welcome back. I hope you're having an amazing time so far. Our next speaker is Suelyn Boucree. She is Network Medical Director, Quality at Hackensack Meridian Health Network. Please join me in welcoming Suelyn to our virtual stage.
Hi, good day. Thank you for joining me. Today, I'll be talking about how AI is revolutionizing the healthcare industry. In the first half of the 20th century, science fiction familiarized the world with the concept of artificial intelligent robots. Since then, through many iterations from the Logic Theorist, the highly popularized chess match with Deep Blue, and Kismet, among others, a whole new world of AI has been spawned. All industries today utilize AI. The healthcare industry or field has been potentially slow in its adoption of AI. However, since the use of the Dragon, a speech recognition technology that translates talk to text, AI in healthcare has improved and expanded by leaps and bounds. Today, AI plays a key role in clinical decision support, precision medicine, health policy, cost, provider satisfaction, patient data, and security. I believe the journey with AI has just begun and its applications are boundless. On the agenda today, I'll be discussing challenges in healthcare. What exactly is AI in healthcare? What does AI address? What are the major applications? How does AI transform healthcare? How does AI provide better treatment and productive workforce? How is AI impacting patient satisfaction? And then a summary slide showing how AI is really affecting quality as per the IHI quadruple aim. Healthcare has many challenges. For patient experience, there's no standard operating model to ensure patient experience is seamless and frictionless. There's lack of price and transparency and consistency. We often hear about cyber theft. As far as workload, there is excessive workload on healthcare workers, leading to fatigue and absence from the workplace. There is cost prohibition in many different settings across the health sphere continuum. And as far as customer acquisition, acquiring and retaining patients at low cost is a huge challenge. What exactly is AI in healthcare? AI describes the application of machine learning algorithms and other cognitive technologies in a setting. It occurs when computers and other machines mimic human cognition and are capable of learning, thinking, and making decisions or taking actions. It's used to analyze and act on medical data, usually with the goal of predicting a particular outcome. Here's a schema that I put together that shows how AI translates into action. AI, as I said, is marked by the building blocks being machine learning, but there are some pre-processing algorithms and sets that can be used, including natural language processing and dimensionality reduction. ML, or machine learning, has different subsets, one of which is deep learning, another being gradient descent, and yet another being SVM. So what are the problems that AI is trying to address? Complexity. Well, what it does is that it ensures complex tasks are simplified. For efficiency, tasks are completed with higher efficiency and greater speeds. And for rework, it reduces rework and improves the overall productivity. As mentioned previously, major applications include clinical decision support, precision medicine, healthcare policy, provider satisfaction, patient data management, security. How does AI transform healthcare? Well, this can be across the full spectrum of healthcare, from acute care in the hospital setting to the ambulatory practices. So it provides health advice directly to patients, thus reducing workload for clinicians who can therefore focus on more complex care. AI can also be used to automate some primary care that results in greater efficiency and speed for patients and physicians alike. And by utilizing population health tools, AI can optimize performance both in the hospital setting as well as in the ambulatory setting. And more we find that there are AI-enabled wearables, which may lead to early intervention and early detection of disease, resulting therefore in improvement in capturing and decreasing morbidity and mortality. For treatment of disease and improvement in the productive workforce, AI provides quicker and sometimes more accurate diagnostic capabilities. The technology reduces cost of care while enhancing efficiencies, therefore driving profitability. Integrating AI and technology in medical field can also result in the patients getting better care and treatment. And it can reduce administrative burnout through the use of chatbots, for example, or the use of nursing robots. Patient satisfaction is a forward predictor of an organization's success. We should say client satisfaction or customer satisfaction. In this case, it's patient satisfaction. And so it's very, very important to be able to capture this in a succinct way. And more in today's world, AI is providing or charting a way forward with tools that can assist with this. The machine learning system provides an opportunity for hospitals to improve overall health outcomes. We know about the HCAHPS scores. Also, for NRC data, this utilizes pre-processing with NLP that might feed into an ML algorithm to assist with better capture of patient sentiments, and that can trigger other necessary interventions. In the complex context of hospitals, interoperability of data becomes critical, and machine learning technologies can assist with improved data and systems solution. AI chatbots are perceived as competent and human-like and can also boost patient satisfaction. So artificial intelligence in healthcare quality, as it is perceived by the IHI or Institute of Healthcare Improvement across the quadruple aim. For coordinated care initiatives at Hackensack Meridian Health, we utilize different models that look at predictive models, that looks at early onset of disease and can therefore be used to better overlay treatment strategies for better outcomes. So here we use ML for predictive models that drive improved health outcomes. The CMS Millions Heart model is an example of this. For efficiency and cost measures, predictive analysis or forecasting using regression analysis or machine learning tools can be used to predict trend lines for future costs and efficiency as well. We are also looking at overlaying seasonality data, where you can pick up on anomaly detection and determine variant size, and that can potentially lead to the determination of causal factors. For patient satisfaction, just as I've mentioned just now, the National Research Corporation data utilizes sentiment analysis that uses NLP technology that can have a precursor to the more sophisticated machine learning technologies that can account for and cipher through negative words and provide a more fuller context that is more enhanced to decrease the misclassifications. And as far as employee well-being, better incentive models are present for provider engagement and participation. And just as mentioned just now, chatbots and AI nurse bots can be used to reduce clinical burnout, and clinical inertia can be reduced. As far as healthcare and AI, one of the biggest questions that will probably and will for certain actually be on everybody's mind is the ethics when it comes to the speed at which AI is influencing healthcare. And irrespective, healthcare is on the verge of revolutionization, and AI is here to stay. Thank you, and I'll take any questions if anyone has any. Thanks for listening.
Wow, Suelyn, that was amazing. Thank you so much for sharing. I know this virtual audience is giving you a huge virtual round of applause. Thank you again for these incredible insights. And for the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our awesome exhibits. Thanks so much, and we'll see you around.
Thanks. Bye.